hosted by the SYNERG-IE Sjögren's research programme at the Royal College of Surgeons in Ireland, along with the Sjögren's Ireland Patient Advocacy Group. So, as Nikki already told you, my name is Jude, and I'm a member of SYNERG-IE's PPI Advisory Panel. PPI stands for Public and Patient Involvement in Research, and our panel makes sure the patient voice is represented in the research process. I was diagnosed with Sjögren's 9 years ago. So I'm delighted to introduce our two speakers here today. The first speaker is Dr. Eleanor O'Sullivan. So she is a dentist who has expertise in oral oncology, and she has spent 4 decades looking after patients in the dental hospital, and she's currently primarily engaged in research. She will discuss effective strategies for managing oral care in Sjögren's disease. Following her presentation, Dr. James Barlow is a pharmacist and a senior lecturer in the Department of Chemistry at RCSI, and he will share his recent research on the use of complementary and alternative medicine by individuals with Sjögren's. So I'll now hand you back to Dr. Nikki Dunn, who will guide us through the housekeeping for today's event.
Oh, Nikki, you're on mute.
I'm glad I was the first person to do it, and hopefully the only person. So as many of you will have heard, the webinar is being recorded, and it will be shared on RCSI's YouTube channel and via our website as well. For that reason, you're very welcome to keep your cameras on or off, whatever you're comfortable with. But we'd also request that you don't share any personal information or other sensitive data as well, or information during the Q&A. We have everybody muted throughout the call just to avoid any background noise. But during the questions and answers session, where we'll try to get time to get to every question, we may not, but we'll do our best. But we'd ask everybody to use the raise hand function in Zoom if you'd like to speak, and then we'll invite you to unmute yourself to ask your question. And you can find that at the raise hand function at the bottom of your screen in the reactions button. And once your hand is raised, we'll invite you to unmute yourself and ask your question. If you're not comfortable asking the question in person, or if you can't find the unmute the raise hand button, put your hand up and we'll keep an eye out for you as well. But you can also type your question in the chat function at any time. And my colleague, Professor Michelle Flood, is keeping an eye on the chat as well. So she'll group questions together and pose them to the speakers. In terms of how we'll actually manage the questions, we'll have Eleanor give her talk first, and then we'll move on to the questions, and we'll take a few minutes for that, and then we'll move on to James as well. And then the questions for James can be at the end of his talk. And then we'll move on to Gráinne. She has a couple of minutes just sharing some updates. And if we have additional time, we can return to questions. Otherwise, myself and Jude will close the webinar. So thank you for now. I will hand over to Eleanor O'Sullivan. Thank you, Eleanor.
Hello, everybody. I'm just trying to share. It's saying allow multiple presenters to share, so I'll try that. Yeah. So share. So it is a pleasure to speak here today, and I want to thank the organizers for the invitation to do so. I've spoken a couple of times in the past, so I'm taking a little bit of a different slant today, so I hope that will go down okay. So my name is Eleanor, and I've spent about over 4 decades working in healthcare, mainly with cancer patients, but it was head and neck cancer patients who suffered from extreme dry mouth, and also many Sjögren's patients. So that's where I'm coming from. And secondly, I am somebody who's lived with Sjögren's and another A4 page of autoimmune diseases, so I can see it from both sides of the fence. And I think I'm using that expertise as well. So in my other talks over the past couple of years, these are the things that I have actually focused on. We've looked at biopsies, diagnosis, all these different aspects. So I'm going to skip a lot of these because you can still access all that information on the existing recordings on the really good website that has been set up by Sjögren's Ireland. But for anybody who's not used to living with all the aspects and the impact of Sjögren's, we may have family members, we may have a couple of experts who are here from the medical field looking for the physical clinical signs that it has on the mouth. I suppose number one key giveaway would be the lack of salivary pooling. The average person who has a normal salivary flow, if you stop them from swallowing for roughly a minute, will have a nice small swimming pool of saliva under the tongue. For somebody who has an issue in producing saliva, that won't happen. And any saliva that is produced will be frothy, viscous, sticky, quite bubbly, and not at all as useful as the normal saliva in relation to lubricating the mouth, in relation to getting rid of plaque and bits of food that accumulates. So you'll see bits of plaque accumulating at the edges of teeth and also inside in the kind of gutters of the gum and even underneath an individual's tongue. And it's important not to be judgmental and say, you know, you have to keep your mouth clean. Often these people are actually brushing 3 or 4 times a day and still not getting all the plaque off. The skin of the mouth, which we call the mucosa, is red, inflamed, very tacky to touch, and it's described as having a bald, irritated, inflamed tongue that can be really sensitive, and it can be lobulated like the picture there. You also have an increased incidence of swellings in the salivary glands, and there's also an increased risk of non-Hodgkin's lymphoma, which is a form of cancer. So it's roughly 20 times actually higher than it is in the ordinary population, and the lifetime risk of getting that is estimated between 5 and 15% in different studies. One of the other issues is that anybody who has a dry mouth and anybody who has Sjögren's has unfortunately got a high risk of having recurrent infections, most common one being thrush, and this is a nice example. Well, nice if you don't have it. You can see it's all over the tongue into the palate, and it's a really hideous condition, but it's very easily treated. So all those would be the physical signs, and then the impact quality of life wise would be, again, this is what anybody who has Sjögren's will be saying: my mouth is dry, my mouth is sore, it's sensitive, it's often burny, I'm more prone to ulcers. I have difficulty chewing my food. I can't lubricate it. I can't get it into a nice bowl to actually swallow. If I'm ever handed anything really dry, like it's called the cracker sign, it's almost impossible to eat something that's as dry as a cracker. And then the lack of saliva means that all the different taste chemicals in our food can't be transmitted to the taste buds. So people with Sjögren's won't have as good a sense of taste and can be altered taste. And taste is such a huge part of quality of life. Other things that can be affected would be speech. Again, it can be sticky. It can be not as easy to actually move and manipulate all the parts of the mouth, including the tongue. Again, denture wearing, people complain of it clacking or falling out, etc., because of the lack of suction. I mentioned already the increased risk of candida, and looking at the photograph here, you can see it's like a stretched out dry piece of skin of parchment. It's really unpleasant and uncomfortable. So other things that people complain about would be bad breath, halitosis, and a hugely increased risk of dental disease, which always comes up. So I did warn you I was taking a different slant, so you'll have to forgive me on that. So I suppose looking at somebody who spent over 40 years looking after patients, and as somebody who's actually been a patient since my early 20s with arthritis and various different things, including Sjögren's, it can be, it can leave a sense of kind of powerlessness and hopelessness, and you can feel that you're being run by your disease. And I think everybody knows that we have a really good health service, but it is overburdened. So what can we do? How can we take back some of this power? And I'd like to quote somebody that I'm actually very fond of, who died in the past week, but was overshadowed a little bit by Pope Francis, and that's Julian Benson. He had cystic fibrosis, but he had one great sentence. He said, I have cystic fibrosis, but cystic fibrosis does not have me. And I think that's a great attitude to have. You know, it's a case of accepting that you have an illness, accepting that, yes, it can suck, but saying, what can I do to manage myself? What tools can I give myself so that I can take back some of the control? And the main tools really that are at our disposal would be knowledge. You are the expert in your own care. I'm not saying that you should turn your back on all the medical expertise. That's not what I'm saying. It's essential to have medical expertise, but you have to help the medics to help you because you are the expert in your body and your experience. It's also important to link in with the advocacy groups. Like we have a fantastic group, Sjögren's Ireland, with huge resources, linking with them. But I suppose the main thing really that we have control about is how we communicate. And our outcomes in relation to any healthcare really depend upon our skills to communicate. Somebody with Sjögren's, many of us who have Sjögren's, it'll be secondary Sjögren's. It can be associated with rheumatoid or psoriatic arthritis or lupus and other diseases. So often we're engaging with a whole big team. But it's important to remember that that team is looking after us, but we are often the common link in between of all these services. So we have to feed them the right information. So your dentist won't be kept fully up to speed by your rheumatologist. Again, your optical services may not be getting information about your changes in medication. So linking in with the pharmacy, which is a huge resource, speaking to them in relation to which of the medications that I'm taking can contribute to dry mouth, which are the newest products coming in, are there any new samples that I can try? Again, making sure that all of the members that are looking after you keep them up to speed in your care. Because our outcomes in life and our outcomes in relation to medical care actually depend on four main things. Access to care, and that can be a postcode lottery. It can be depending upon having an appropriate specialist that you can access easily in an appropriate time. That's not always within our control. So how much money we have shouldn't make a difference, but unfortunately it often does. But other two things that we can control would be our level of awareness, but also how much we let our medical team and our dental team and our optical team, how we feed them our knowledge and let them know that we have this condition. Because if you don't tell them, they won't be factoring it in. And our level and our skills in communication are really important. So simple things that I would just like to highlight. One would be always have a list of your medications on you. If you get knocked down by a bus or whatever, you need that knowledge. If you're going to any consultation, you need that knowledge. I've had so many patients over the years coming in telling me I'm taking 3 pink ones, a green one and a blue one, and I don't know what they are. So it's really important that you can feed all the members of the team looking after you that information, because so many of the drugs that you're taking for one aspect of care have a knock-on impact on other aspects of care, particularly on the oral cavity. It's also important that you know the ones that you took in the past, the ones that did suit you, the ones that worked, and the ones that didn't agree with you. One of the suggestions I would make is that if you're going for a significant consultation, that you'd bring a trusted friend with you. It's really good to have 2 pairs of ears there, because you may actually have things you want to talk about and your friend can prompt you. You said you wanted to talk about that. It's also good to have somebody who can rehash the conversation going home in the car, because you can get a lot of information at consultations and it can be a lot to take in. The last thing that I would say is when you know you're having an appointment, sit down at least a day before over a cup of tea or a cup of coffee or something and write down, what do you want to get out of the consultation? Make a list of your top 3 to 5 issues that you want to address. Don't leave the most important one until you're halfway out the door saying, oh, by the way, I have an ulcer there that hasn't gone in the last 5 weeks, or I noticed I have a lump here. It happens so often. It might seem very basic, but that's how you get the most benefit from your consultations, because medics are really busy. They want to help, but you have to help them to help you. Taking the same approach in relation to the oral cavity, one of the most common things people with Sjögren's will complain of is my mouth is sore. The skin is sore, it's dry, it's irritable. And so you need to sit down and ask yourself some questions to take charge. Is this a continuation of the old story? Or is this a new symptom? Is it all over the place? Is it one particular area? Is it an ulcer that isn't going away? Is it linked into anything that I have done? Be able to write down the exact symptoms. Go into your consultation with the information that's going to be useful. It'll save you so much time and it'll really enhance the outcomes. And very often by doing this, you can work out a way to manage yourself. So Is there an infective component? Have you a fever? Have you blisters? Are those blisters becoming ulcers? It could be it could be herpetic stomatitis. It could be a virus of a different type. You know, is there sticky white plaques? You know, it could be thrush. Are you lacking sleep? Are you exhausted? How is your posture in your sleep? Is your mouth hanging open? How is your posture during the day? Are your lips actually sealed, or are you walking around with your mouth hanging open? Because that air in and out is drying out your mouth the whole time. Have you a fractured denture? Have you a fractured tooth? Have you had something really, really hot? Are you taking enough intake of water? Are your other diseases under control? Is your diabetes under control? Have you had a flare-up of arthritis? Has there been changes in your diet? Has there been changes in your drugs? Are you feeling down? Have you had medications for that? Because you looking at all these aspects is going to give you some ideas as to how to manage yourself, and also give you really good information to bring to the consultation if you seek help. Things that you can do for yourself. Number one will be looking at the hydration. Okay, sipping water, often even using ice chips, because it's great to have an intake of water and it's important to be hydrated, but you don't want to be sipping it continuously, because what you're doing is washing away all the saliva that you're producing. I would recommend staying away from carbonated fizzy water, because that's acidic and it softens the teeth. How is your atmosphere, the environment? Have you AC blasting the whole time? Would you benefit from getting a small extra bit of hydration, either putting a saucer of water on top of a radiator or actually buying a dehumidifier for the bedroom? Having your lips sealed if the mouse is not in use. Are you smoking? Have you gone back to vaping? You know, how much alcohol are you taking? We all know from our interactions using alcohol wipes over COVID, alcohol dehydrates every surface. Are you using mouthwashes that contain alcohol? How much caffeine are you intaking? All these things increase the dryness of the mouth. Then looking at ways that you can stimulate your salivary flow. Number one would be medication. Most commonly one used would be pilocarpine. It's not perfect. Some people like it. Most people hate it because it has quite a lot of side effects. Other ways, for example, physical ways to stimulate salivary flow, using chewing gum, using sugar-free lozenges. I have used acupuncture in the past, but I find it works better for people who have dry mouth from radiotherapy than it does from Sjögren's. Then salivary replacement therapies. We have a huge plethora in your pharmacy, again, different in different countries in case different people are in different regions. What I would say is that you have to experiment with them. Ask your pharmacy if they have any samples, or ask your medic, ask any of the team if they can give you samples, because some people like different ones. The best advice would be to use them as a set. Use a lubricating toothpaste that doesn't contain SLS, because that's the foaming agent that dries out the mouth. Use a lubricating mouthwash because it doesn't contain alcohol. It has special enzymes in it. Excuse me. Other things that people find really helpful would be xylitol tablets. These stick onto the skin of the mouth and then slowly release xylitol. Other things, and looking at natural products. Some people find a little rub of butter, using buttermilk. I haven't tried the buttermilk, I have to confess. Using natural fruits, using watermelon, using the ordinary gentle honeydew melon, using pineapple, using ginger, using sage. Looking at your intake of vitamin D. Some people find evening prismus oil is very good, but it is a case of trial error. So it is getting back to you, taking charge, experimenting, you becoming the expert in your own care, in what suits you. I would be careful in relation to fruit. It's great as a stimulant, but again, fruit is acidic and it can cause softening of the teeth. One of the other major issues that people who have dry mouth would suffer from would be decay, rampant decay, and also increased risk of having gum disease. This is because of the lack of saliva and all of the goodness that it brings. So you can see that it tends to start at the very edges of the teeth. There's unusual places. It tends to happen at the necks of the teeth. The most important things to do would be to stay on top of it. Get really involved with the dental team. Tell your dental team that you have dry mouth. Let them know the conditions that you have, because otherwise you can get teeth literally snapping off, crown amputation. And this is somebody who actually has brushed their teeth. It might look like a manky mouth. It's not. The person from here to here, the teeth are gleaming and shining. It's because of the lack of saliva. They have sticky plaque accumulating there, and it's just sticking, and it's hard to shift. So things that will help would be using a mouthwash that contains chlorhexidine, because this makes the plaque less sticky. Using different tools and tips. And again, if you have arthritis, modifying your toothbrush so that it's easy to hold. A lot of people are being pushed towards using electric toothbrushes. If it works for you, great, but I personally find a manual brush gives you much more control. Really, really important to use dental floss in any of its forms, because if you don't floss, you need to floss at least twice a day, you need to brush at least 4 times a day. Frequency that's abnormal in relation to the average punter. If you don't floss, you're actually missing 40% of the teeth. Then in relation to how to toughen the teeth, using fluoride, again, different options. It can be fluoride trays, it can be fluoride varnish at the dentist, but you can get fluoride rinses and you can get a very strong fluoride toothpaste. Other things then would be things to protect the enamel, for example, Sensodyne Pro enamel, or getting a GC paste, which is an extract of whey, and it's the only thing that has calcium phosphate and fluoride in it. So getting towards the end, other things that people complain about would be mouth ulcers. So again, over-the-counter care things that are really good would be things that contain aloe vera, harmless, useful, very good. Aloe Claire would be one of those. Things that contain hyaluronic acid, which despite the name acid is actually very soothing and very gentle, and it restores the skin layer over it. And examples would be Genji gel and Kin Care. Then ways to numb it, using topical anesthetic. Again, there's a really good product, Kin Care, which is very helpful for that. So you can get things then that are prescribed either by your doctor or your dentist, and it can involve using steroids, ointment, steroid tablets. Short, sharp doses are really, really good. In relation to lip care, avoid licking them, because if the lips are very dry, it's tempting to lick them, but then the saliva will just evaporate and make them even more. So I just want to finish up by saying that it is important that we take charge of our own health, engage with the services, but engage in a very structured, intelligent way, because you taking control of your own body and you doing what you can to self-manage yourself and making every interaction you have with medics important and useful to you. So I hope that was of some help. I'm happy to answer questions.
Thanks so much, Eleanor, for that really insightful talk. Lots of practical advice there. So we'll now, if you want to maybe stop sharing, or we can
Yes.
open up for questions. And again, you can put any questions into the chat box or put your hand up, and we'll try to come to you if you want to ask the question in person. So I don't see any hands for the moment. Oh, there, Anne.
I thought I'd scare them all away.
Ah,
Sorry, I couldn't find the
Hi,
hand
Anne.
there. Hi. I just want to know, have you come across salivary ducts being blocked much, and what's
Yes.
going to do?
It tends to happen in a couple of places, not so much linking specifically to Sjögren's, but it can often be linked into debility. So somebody who is unwell, who has become very extremely dehydrated, somebody who's had surgery and has been having very limited oral intake as part of the actual hospital intervention. If you've stasis in the mouth, if you haven't got saliva being stimulated, you can get bacteria going up along the duct, out of the oral cavity, up into the duct, and this can cause a blockage. Really, really painful, and very important to seek help. If it's a minor blockage, what you can do is you can start sucking acidic lemon drops, using lemon itself, to see if you can stimulate salivary flow. But the problem is when your gland is not able to produce good salivary flow, if you're lucky, you might be able to flush it out. I would suggest going to your local oral maxillization surgeon, okay, or oral medicine, but it really is an oral surgery issue. They will actually undertake a test, which is it's a specific X-ray, which is actually a cyanogram. It injects opaque substances up into the actual duct, and it shows the location of the blockage. If the blockage is near the opening of the duct, sometimes it can be literally milked out. If it's a wee stone, it can actually be dislodged and milked out if you're very lucky, to be honest with you. But often it involves opening up the duct and actually extracting it, and it'll be a surgical procedure. So I would encourage going to or getting a referral to oral surgery. If you live in an area that has a dental hospital, you can go there. If you happen to have a medical card under a HSE service, you can seek a referral there to the maxillofacial department, but unfortunately the waiting lists there are very long. So if it's something that you've experienced in the past and it has been a minor blockage, I would hit it using sucking lemons. But that tends to work better for somebody who has a normal salivary flow, because you're trying to stimulate your own cells inside the salivary gland to actually make a little overload and flush it out. And when your gland isn't capable of producing much saliva, that doesn't tend to work.
And sorry, can I just say, and if you have a swollen duct, is it necessarily just blocked, or are there other things it can be?
Excellent question. It can be an infection. And again, number one would be to increase your hydration. See if you can flush it through. Okay. I would also use a mouth rinse, which will be bread soda and salty water. If you make a pint of water from the kettle, I'd stick in a spoon of salt and a spoon of bread soda. It's a very soothing, useful rinse anyway. I would hit the lemon drops, but again, if it's red, if it's inflamed, if it's swollen, and if you have any fever, it needs an antibiotic, and it may resolve again. And it tends to be, if it's due to infection, it's normally recurring, and again, it tends to happen in people who are not well, who don't actually have great oral intake, who are not eating, chewing, masticating, getting the salivary glands actually working. And that would be the suggestions that I would give. It may well need an antibiotic. You'd normally be a little bit unwell. It would be quite painful. If somebody has a blockage, it tends to follow a pattern that when you start thinking about eating, you start thinking about food, and a normal salivary gland starts to produce saliva in response to the idea that it's going to get food to process. And then you have a blockage causing a dam, and this causes back pressure into the gland. And it's actually the back pressure of your salivary flow building up and not being able to get out that causes the pain. That tends to happen more in normal glands, because the problem in relation to Sjögren's is the autoimmune disease. Actually, it interferes with the capacity of the gland to be able to produce enough saliva to flush itself out. Sometimes you actually have to have the gland removed. Tends to happen more in the sublingual glands rather than the large parotid glands here. If it's in relation to Wharton's duct, which is the one leading into the parotid, that can often resolve using antibiotics. It doesn't tend to work that well trying to flush it out manually, but yeah, those would be your options.
Great, thanks, Eleanor. There's a quick question here from Tracy in the chat before we go to James. Tracy asked, was it a toothpaste that doesn't froth? Thanks.
Yes, it's any of the ones specifically for dry mouth. Anyone who, it's the substance SLS will be written on it, is the frothing foaming agent. It's what makes all of us start brushing and everything starts to foam up and makes the mouth kind of zing and make it feel nice and clean. But unfortunately, the SLS, which is the foaming agent, it sucks all the moisture out of the mouth. So you want a toothpaste that doesn't have SLS in it, but it does need to have fluoride in it. We have a couple of brands now that are kind of herbal brands, but they don't have fluoride in them. And fluoride is your gift in keeping your teeth. It is essential, and you need to have really high strength in the fluoride. And the one I recommend for that is Durafat. It comes in 5,000 or 2,800. Anybody who has extreme dry mouth needs to be using the 5,000 one once a day. Tooth extraction needed, denture or implant. Extractions to be relatively straightforward. Okay. You don't usually have an increased risk of having complications. You can have it replaced by an implant. Implants have about a 4% rate of failure, which isn't that much higher than in an ordinary person. And it's inexpensive, but it's a really good option. And in relation to fillings, I would recommend that anytime anybody gets a small cavity, the most important dental advice would be to go often, because you want to get every problem when it's small. And stop things getting to the stage that you have a tooth crumbling and that it needs an extraction. But again, let the dentist know that you do have a dry mouth and that it's really important to have help to keep the socket clean.
Thanks so much, Eleanor, for your really thoughtful responses to the questions, and for the people that asked questions as well. They were very thoughtful too. So we'll move on to our next speaker. Thank you so much again, Eleanor. Really appreciate your very practical talk. So we'll move on to James Barlow now. James, I'm going to share your screen for you.
Thank you.
Can you see that, James?
Thank you, Nikki. I can, although it's quite small. Can you perhaps put it into, yeah, presentable? Thank you very much. It's great. So hello, everybody. I perhaps have talked to some of you before online when I gave an overview of complementary medicine use and what complementary medicines are and are not. And following that, we were interested in determining usage and patterns of CAM use in patients. So we thought we would do a research project on this, and many of you perhaps kindly participated in that. So what we're doing today, I see Frank on the call and Michelle on the call. We collectively, along with some other, I see Niamh as well, with some other authors and Gráinne and patients, to put together that work into a paper which we have published. And on the next slide, you can see that publication, which is in Rheumatology International, just published this year, the use of complementary and alternative medicine, or CAM, among people living with Sjögren's, a cross-sectional survey using a modified international CAM questionnaire, or ICAM-Q. So we used a validated instrument called the ICAM-Q, which is an internationally accepted way of determining complementary and alternative medicine use in populations across the world. So it's been used in national surveys of the entire population, but it's also been used to a lesser extent, but to some extent, in individual groups of patients, such as how we used it. So we were very happy to get this published and accepted. So I'm going to take you through some of the high-level findings in the next few slides. So perhaps if you could go to the next slide. I wanted to contextualize it and why CAM is important. So I think it's interesting what we've just been listening to from Eleanor, of course, with regard to communication and being key to management of your condition. And I think that's so true in the context of obviously everything, but in the context of CAM, it's particularly important because we know that a lot of patients in general, not just with Sjögren's, but people in general don't always disclose CAM. However, we know that people with chronic conditions are some of the more common users of CAM, and that of course includes people living with Sjögren's. So we know already that Sjögren's has a diverse impact on people, of course, and this often can be contextualized, and often the focus is on the obvious in terms of the obvious glands and organs affected, which is natural, and also on daily living and functioning. But there's a recognition, I think, increasingly in the literature and in guidelines that there is an individualization needed. And what works for you was also mentioned by Eleanor, and I'd echo that here. There's a diversity of approaches that are and can be used in the context of CAM. It's also known through recent research that from the portion of satisfaction perspective, that a lot of patients with chronic diseases, including Sjögren's, are not entirely satisfied with the management. Now, they may be completely satisfied with aspects, but in a holistic overall way, there may be gaps. And this is often cited in the literature as an indicator of turning to CAM use. So not just within Sjögren's, but broadly, people with chronic conditions often do have dissatisfaction with various aspects of care for different reasons. And that can be a reason why they might turn to CAM use. So for the perspective of today and for our study, we had to define what we meant by CAM, and we took the WHO definition there, which is, as you can see, restate it here. So just to remind you, or if you haven't heard this conversation before, just to be clear what we mean by CAM. So CAM stands for complementary and alternative medicine. And it's defined by the WHO, the World Health Organization, as a broad set of healthcare practices that are not part of that country's own tradition or conventional medicine and are not fully integrated into the dominant healthcare system. I think it's important to think about the two words complementary and alternative. They really give off two different images. So the idea of complementary is really more from an evidence-based practitioner would like to see it, whereby perhaps usable CAM is used alongside or as part of, but it doesn't replace. So that the word alternative can give a different, I think, emphasis, which can be somewhat negative. But really, my ethos would be, from somebody interested in CAM and natural products, would be it's important to take an evidence-based approach and consider where they might be supplementary or complementary, but not really alternative. So that's my perspective on the definition. Perhaps we can move on to the next slide when I can introduce our research questions. So now, hopefully you've got a sense of why we wanted to ask this question. So we wanted to determine the usage of CAM practices. And given that it's a broad umbrella, it can include lots of different things. It can include visiting a practitioner. It can include using a CAM that you have self-selected and purchased yourself, perhaps a herbal remedy. Or it can be something like a self-help practice, like a yoga or meditation. So really, straight away, if you haven't heard of CAM before, discussed in this way, you can see that it is a broad church. And really, there are many different practices that could be considered as complementary and alternative. We wanted to know just how much our population were using some form of CAM or some forms of CAM. We also wanted to know why, and we also wanted to know what they thought about it. Did they feel that it was helpful or otherwise with regard to supportive management or management of their Sjögren's? So if we go to the next slide, please, we can see straight away some of the demographics within our survey. So our questions were asked as part of a survey that dealt with CAM use, but also other aspects of managing Sjögren's. It was delivered in 2023 in the end of the year. And here are some demographics. Now, I'm not going to go into the in-depths of anything. I want to go into the sort of higher level. You can see we first collected demographics. A proportion of our majority of our respondents were female, which you would expect. And you can see that it covered various age ranges, or all age ranges were represented, and that about half of the respondents were Irish, but there were also good representation from other countries. Now that's important because CAM types that are used do tend to vary culturally, which of course makes sense, but different countries have different proportions of CAM use in general, so you might expect there to be variance. But over half of our proportion were Irish. And in Ireland, CAM is very much, kind of niche in comparison to its use in other countries where it's much more integrated, such as in parts of mainland Europe. And we also found, if you can move along, thank you, that the occupation and working ability of people with Sjögren's was markedly impacted. And you can see that of those who were not working full time, there was a significant proportion working reduced hours or unable to work. So this really highlights the impact on quality of life that Sjögren's has. Also, we recognize that over half of the respondents had at least one concomitant medical condition. So on the slide here, you can see in the bottom right, if you animate, please, there's 10 most common medical conditions, but there were many others, but you can see that there's a crossover with arthritic and other conditions and immune conditions there, and that reflects a common experience. So that was a kind of an overview of our demographics, perhaps not overly surprising, anything there in terms of patterns, mirroring what we might have expected. And then we moved on to look at some of the actual results. So the ICAM-Q really takes different questions. Firstly, it looks at the attendance at healthcare providers. So this covers both conventional healthcare providers, and in ours, we included doctors and physios who are not normally asked about in the context of the ICAM-Q, but we felt that it was important in the context of our group. So you can see there that there was significant attendance across doctors, GPs, our other doctors and physiotherapists. And this is the first time that we've that actually the impact of the physiotherapy has been physiotherapist has been formally documented. You'll see then on the rest of the table that there is a long list, or a reasonably long list, of other CAM providers that that were visited. So if you don't mind animating this slide, please. You can see there that I've highlighted first what we consider the conventional practitioners, and then in the next animation, you can see that we're highlighting the other CAM providers. So roughly speaking, 1 in 4 respondents did attend a CAM provider. So that's quite significant, and it is bigger than you would see in the background general population. The other interesting thing is why they were attending. So you can see that for both types of practitioner, there was a more frequent attendance for the management of chronic illness and well-being rather than for acute illness, although doctors and physios in a conventional perspective were more commonly consulted for acute management rather than the others, as you might probably expect. You can also see from a helpfulness perspective that most interactions were deemed to be helpful. I have one other point, if you can animate, please. You can see there that's echoing my point about management, well-being being the main reasons, and then that satisfaction rates were fairly uniformly high. If you can go to the next slide, please. The next aspect of CAM treatment that was looked at under the ICAM-Q is the types of treatments that were being provided when they did go to those providers. So we've seen the kind of providers that people were attending, and largely speaking, while again a diverse range of different treatments are obtained directly from the providers themselves, you can see that manipulation and acupuncture, if you could animate, are the two most commonly obtained from providers. This kind of makes sense because a lot of the others would in fact be open to self-selection, whereas the manipulative type treatments, of course, one would need to attend for that actual service. So manipulation and acupuncture, and I know acupuncture was mentioned in the last talk, was fairly frequently, compared to some of the other forms of CAM, utilized by our group, and particularly in the Irish subgroup actually, which was interesting. If we go on to the next slide then, this looks at the self-administration of CAM products. So most of these products are really available in either pharmacies or health food stores, and of course, many of them are available online. Now, there is a significant caveat in purchasing materials online, which is with regard to identity and quality considerations that is really important and should always be highlighted. But from the perspective anyway of the types of CAM products that people were self-purchasing and self-administering, you can see that we can divide them into 4 categories: herbal products, vitamins and minerals, which were the most commonly encountered, homeopathic products to a small extent, and remember what they are, they're highly diluted products, and finally dietary supplements. And dietary supplements is a broad category and can include materials that are processed from plants or that are processed in some way. So they're not like the crude herbs. They're, for example, an oil obtained from a herb. So evening primrose was mentioned in the previous talk, and that would be considered more of a supplement than the herb per se, because you're not using the evening primrose as a crude herb, you're using the oil. So that's the difference there. If you go on to the next slide, you can see, the animation, thank you, is that it shows that a high proportion was actually used. And another important point was that people were using more than one of these. Now that highlights another point, which is the potential for drug interactions. And if you're using more than one product on top of potentially conventional medicines that you might be using, there is the potential there for interactions. They could be harmful or harmless. Many times they're irrelevant, but there is the potential. So that really, I suppose, underlines the point that it's important to discuss them. And then when you're discussing your care with any provider, you're including your use of these products. So to echo what Eleanor said, that it being a good idea to have a list of questions and to a list of what you're on when you go to a provider, I would echo that by saying it's also good to include the supplements that you're taking. And in fact, physically putting them in a bag and bringing them can be a really good way of doing it, because many of these are quite complex and it's hard to really be able to explain them. So simply putting them in a bag and bringing them with you is a good way of doing it. So what I've done over the next 3 slides is to create 3 word clouds, just to give you an idea visually of the more common. You'll appreciate that a huge range of individual vitamins, individual minerals, individual herbs were listed. So I'm not going to bore you with big, long tables, But what I've done is created a visual representation. So here you can see the size of the lettering really highlights the fact that they were more common. So vitamin D, there's a big D on this slide, is highlighting how common that was used. Now there's prescribed vitamin D and there's supplementary vitamin D, so that's also another variable, but we were focusing mainly on self-selected products that were purchased. So not on, for example, high-dose prescribed vitamin D or high-dose prescribed vitamin B12, because they would be considered conventional medicines as opposed to CAM. In this context, though, you can see a lot of people were also using multivitamins and minerals. And that brings up the point that when you're taking multivitamins, you may, if you're taking other minerals and vitamins, you may be having multiple versions of the same thing in different containers. So it's just an important point to note, bearing in mind you're not taking beyond the recommended amounts from a daily intake perspective. If you move on to the next slide, then you can see that I've done the same thing, but for food supplements. And again, shining bright here is the fact that people were using a significant quantity of probiotic products, but also and mostly omega-3 products. So these are fish oil products and cod liver oil, a particular source, but also some other omega-6 products like evening primrose oil were mentioned, and some other plant-derived products. So it's important to note that the oil types chemically that are obtained from fish are different from those that are generally obtained from plants, with a small degree of overlap, and that these oils have different roles in the body, and there's different degrees of evidence about taking various things. You can also see that there are various different other food supplements mentioned as well. If you go around the slide, things like lysine as for example, an amino acid supplement, and then individual extracts of herbs like curcumin, which comes from turmeric. If you go to the next slide, which shows herbals, that's also highlighted here because the big word shining out at us is turmeric. This was the most commonly encountered individual herbal medicine, along with marshmallow and ginger. It represented the most commonly encountered herbal products. Most of the products in this slide really are targeting either a soothing effect on the gastrointestinal tract, on the oral cavity, as you might expect, but some of them are immunostimulants, and there are others that affect other organs, such as cranberry, which has an effect, or is often believed to have an effect on the urinary tract, but again, on the lining of the tract. So that's given you a sense of the diversity and more commonly used products that people are actually taking that are self-administered. If you move on to the next slide, please. This also highlights an important question, which is adverse effects. So the ICAM-Q doesn't normally ask about adverse effects, just like it doesn't normally ask about physiotherapy, but we wanted to ask this question, so we added it in. We saw that people quite frequently reported adverse effects from conventional medicines, which perhaps mightn't surprise you because they're quite potent medicines, relatively speaking. And most of the effects that were reported were tummy, so GI, gastrointestinal, neurological, things like headache and the like, maybe migraines, dizziness, immunological, such as rashes or allergies. And then in the context of complementary and alternative products, it was nearly always just gastrointestinal symptoms that were reported. But this gives you an idea of the fact that adverse effects can be experienced from taking any supplement as well as any medicine as well. And in fact, you can have an adverse event from a manipulative therapy, of course, as well. It doesn't have to be something that you actually consumed. It could be an adverse effect following some movement therapy or some other form of interaction with a CAM provider. On the next slide, you can then see the final question of the ICAM-Q, which is about self-help practices. So this is deciding that you're going to try and take charge of your condition to some extent by doing something that you've self-prescribed in essence, such as, for example, meditation, which was quite high on the list here, also relaxation techniques, yoga. These were the most common, and prayer, interestingly, is listed there as well. And prayer is considered in the CAM world as a form of self-help. Obviously, people's motivations for doing many of these may vary and may differ, and there may be overlapping motivations, but in the context of their use for supporting Sjögren's, we specifically were looking for. You can see there's a range of other techniques mentioned there. I think, Nikki, I have one other slide. Oh yeah, just I was highlighting the commonly used self-help therapies. The final slide then is the key takeaway messages. So this is really the summary. So if we think about each of these points for a moment, just to give you the impact, 84% almost of our respondents, which were nearly 300 people, had used some form of CAM, be that manipulative, be that a herbal treatment, be that a self-help practice over the preceding 12 months. That is substantially higher than the background percentages in the literature for the general population or indeed many other conditions. So really, within our cohort surveyed, CAM is significantly and broadly used. So we need to acknowledge that fact. Second point to take away is that 1 in 4 had attended a CAM practitioner specifically. So that's again higher than the background population. The next point being that why they went. We know now why they went. They went primarily for chronic conditions and well-being, more so than for acute symptom management, for which they went more so for conventional approaches. The next point was that 66% were reporting self-administered CAM. These were predominantly vitamins and minerals or dietary supplements, such as the vitamin D, omega oils, and probiotics that were mentioned there. And finally, we can see that 70% used self-care practices. So this is trying to take care or to take control by introducing into your regime some sort of self-help practice like meditation, relaxation techniques, and prayer. So really, I think that this shows you the impact of CAM utilization and within our group, and also why people were using it. And really, I think from my perspective, reiterates the need to say, okay, CAM is very diverse. There may be some evidence for some forms of CAM, perhaps more so than others. It's important though to declare it, to use it in a way that is complementary and with your other healthcare providers, to declare it and to be aware that in certain cases there might be mix-up issues in terms of drug interactions or food interactions or even herb interactions. And just to be aware that that is a possibility, and you can reduce that possibility by simply declaring them to any healthcare provider that you're actually interacting with. So really it's about full disclosure and having broad open communication about CAM indeed as part of your overall care along with anything else you might be doing. So that's all I have to say. I hope that was insightful in terms of how people were using CAM in our survey, and thanks to all who participated.
Thanks so much, James. That was really fascinating and quite complimentary actually to Eleanor's talk as well. So great to have the two talks aligned so well. Can we open up for questions?
Can I just jump in, Nikki? We have a question from Dion, which is great. And I might ask James and Eleanor both to comment, I suppose, from the different perspectives. And just to reassure Dion, that's part of the reason we did this research, was because we feel that healthcare professionals could do a little bit more understanding and a little bit more support around, expecting that people who are visiting them that are living with Sjögren's will be most likely in 4 out of 5 cases from the work we've done, will be using some kind of complementary alternative approaches, and that actually, us taking I'm a pharmacist by background, us taking responsibility and skilling up in these areas is every bit as important as, kind of making sure we're meeting patients where they are and what they need. So I know we're not going to comment on very specifics, but just if you could kind of maybe James and Eleanor comment on Dion's question, you'll see it in the chat, if that's possible, because it's a great question.
I'm happy to go there. Fantastic. Really feel for you, Dion. I've been there. I've been there going back 40 years ago. I am a strong believer in the use of complementary medicine, and I echo everything in the fantastic talk by James. I have met huge resistance over the 40 years in relation to the use of complementary medicine. I'm anti against the idea of alternative medicine, which is turning your back on accepted information and knowledge, but I think that we have to work hand in hand together. You will meet people who will meet you halfway, and you will meet people who are closed-minded. So I'm a very blunt individual, and I think that you are the expert in your own body. I think that you sound like an articulate, intelligent individual who is well able to articulate the issues. Swimming, yoga, I have never heard of anybody ever reporting any impact other than positive. You know, I think that it comes down to you using your excellent, well-tuned common sense and taking the best out of both. And I think that there's a lot of misunderstanding. I think that unless you live with Sjögren's or you speak to a lot of people who have Sjögren's, it's not easy to empathize and put yourself into the patient's shoes. And I suppose in the overburdened healthcare, it's easier to write a prescription than to go into details. But as I say, like I have been a huge user of arnica for 40 years, and I remember I was using it after my son fell down the stairs, and he got the face eaten off, and I got the face eaten off me in A&E. Wouldn't you go off and start using some real drugs, you know? So you're going to meet resistant people. I think listen to your body, listen to your head, know what's working for you, make sure there's no interactions, make sure that what you're using makes sense to you. Some of it you share, some of it you may have to keep to yourself, you know, especially in relation to things that are utterly harmless, like yoga and swimming and things. So I don't know if that's any help to you. What would you think, James?
Yeah, I agree. I think there's a lot of you know, ignorance and fear in the conventionally trained scientific population, particularly when they can't get their head scientifically around, or if there isn't an explanation as to why something helps. From my perspective, and I'm a chemist, I like to understand why things work, but I don't have to know if there is an evidence base for it working. So, for example, there's increasing evidence for things like yoga. Actually, there's a lot of studies on yoga, not just for Sjögren's management, but for other things like back pain, where there's, you know, increasing evidence that it helps. But despite that, there's a big resistance to incorporating it within guidelines. So, you know, guidelines, and I think in Sjögren's there's actually an increasing a little bit of movement there in a positive way, where they're recognizing that you know, people are using things. We need to reflect that, recognize it, respect it, and include it when there is evidence base. I think the problem is that CAM is very diverse, and there are examples, of course, of harmful CAM interventions, and we need to be clear about that. We need to have a you know, an evidence-based perspective, but you know, you need to look at things from the perspective of, apart from efficacy, pharmacists will always talk about efficacy, quality, and safety. And I think there are three important parts of a conversation. But I think from reading your question, Dion, you're very proactively trying to take a holistic view. We teach our students that they should take a holistic view and that they should help the whole person. So they're not looking at the condition, they're looking at the person, and that person has lots of diverse aspects, including their lifestyle and their interventions, and recognizing that that's their choice. You know, they're making choices, some of which you might agree with, some of which you might not agree with, but you're trying to actually support them in ways. So what you're doing, I think, is very positive. I would encourage you to be very upfront with it. I always say to declare what you're using as part of a general conversation. Don't wait for it to be asked, because then you're almost, it's almost, some patients say that they're almost embarrassed or judged for saying that they use yoga. But if you come out straight with that you're using yoga as part of your management and you find it good, then you're kind of putting it out there as part of your management, your holistic management, not as an add-on airy-fairy extra. So I think that being open and being inclusive in your conversation is a good start. It sounds like you're kind of doing that, but I think everybody should do that. I think the fact is that, you know, feeling ignored and rubbishing natural remedies is often based on ignorance, because actually a lot of conventional medicines come from nature. Yes, they've gone through clinical trials and they're refined versions thereof, but that is the case. So, you know, we do have a long history of using natural materials. So I think, you know, you can always challenge doctors if they come out with sweeping statements that are not based in fact with statements like that. And you're not going against medical advice. You're declaring what you're doing, and you're saying, I want to incorporate this as part of what this is a joint decision-making between a participatory decision-making process. That's kind of really where I think people like to be when they're managing their own health. So what I think what you're doing is great, and I would encourage you to keep doing. I'd encourage other people to be quite as upfront. And as Eleanor says, you're going to get the diversity of opinion. In fairness, not everybody is going to be open-minded, and you're not going to fix that one. But yeah, I think what Anne is saying there is kind of similar in a way. Can we expect conventional doctors to be able to say if a herbal interact, as we've been asked before and been told they don't know? They may not know because they don't know every interaction of any medicine, but they should know where to go to find the answer out. And one good example would be their pharmacist. So, we have a lot of resources about drug and drug-food interactions. A lot of them are only documented on individual case reports rather than more broad evidence, but that information is often there. And that's also why it's important to declare, especially if issues are encountered, because that's how we build up evidence. That's how we build up knowledge about both positive and negative things so that they can benefit more broadly the population. So I see Michelle has actually, now that I'm scrolling, I see Michelle has answered that to the same extent. But yeah, there are many resources there. So, we may not always know the answer, but we should know where to go to help to get the answer, particularly about drug interactions.
Great, James and Eleanor, thank you so much. There's a couple more questions in the chat there, James. I don't know if you would be able to maybe respond to them in the chat. Whilst I know we're just a couple of minutes over, but I have a video from our patient representative researcher, Gráinne Tynan, who I'd like to show that before we finish up for the day. So I'd just really like to say thank you to both Eleanor and James for, talks that just gelled so well together and really thoughtful responses as well to some great questions from the audience as well. So thank you to both and to the people who asked questions too.
If I can add one sentence, just if anybody has a question afterwards, I'm happy to answer it as well. So
likewise.
That's very kind of you both. Thank you. I'll just share my screen now for a couple of minutes, and then myself and Jude will close. If people have to leave, that's fine. There's going to be a recording on that we'll share with everyone afterwards. Okay. Can everyone see that?
Hi, I'm Gráinne Tynan, co-founder of Sjögren's Ireland and the patient representative researcher on the SYNERG-IE research program here at RCSI. Public and patient involvement, or PPI, in research is defined as research being carried out with or by members of the public, rather to, about, or for them. PPI is central to SYNERG-IE as our programme aims to co-create solutions with people living with Sjögren's, ensuring that their lived experiences shape research priorities, methods and outcomes. The PPI component of the SYNERG-IE programme includes a panel of 6 patients, the 3 other co-founders of Sjögren's Ireland, and myself as the patient representative researcher. My role involves providing day-to-day advice to the research team on the experience of Sjögren's patients, co-organising PPI activities and events, and contributing to our social media and website. One of the research projects that the PPI panel contributed to recently is our new Sjögren's patient survey, which we will be launching in the coming weeks. The PPI panel provided invaluable feedback on how to make the survey more user-friendly. The survey aims to understand the impact of Sjögren's on daily life, focusing on the treatment and financial burdens. We are particularly interested in the medications you take and the healthcare services you use and pay for. The survey is estimated to take approximately 20 to 30 minutes, but you can pause and resume it as needed. While the survey is primarily online, it can also be completed via post or telephone if the online format is not accessible or suitable for you. Studies like this are important for enhancing our understanding of Sjögren's care and its impact on daily life. If you decide to participate, your responses will help us develop recommendations for managing Sjögren's. We hope to improve medication management to reduce treatment burdens and simplify medication usage. Additionally, the survey will provide valuable information to advocate for the needs of people with Sjögren's, including financial support and access to appropriate healthcare services. We will be starting the survey in the coming weeks and encourage as many of you as possible to participate. The more responses we receive, the stronger and more impactful our research results will be. Thank you for joining us today, and I hope you're enjoying the webinar.
I'd just like to say thank you to Gráinne for, she couldn't be here, but for recording that video for us, and she has signposted to that upcoming survey, which we will be sharing with anybody who registered and through Sjögren's Ireland as well. So as Jude mentioned at the start of the call, we're currently in Sjögren's Awareness Month, and this webinar is a key activity for the SYNERG-IE team to mark Sjögren's Awareness Month. We've also got lots and lots of research going on at the moment. As Gráinne said, we will have our patient survey coming out in the next few weeks, and I'd encourage as many of you as possible to respond to that. I didn't give a brief background to SYNERG-IE at the very start of the call. So SYNERG-IE is funded by the Health Research Board's Applied Programme Grant Scheme. It's a 5-year programme, and it's aimed at improving education, policy and practice for Sjögren's disease. So the patient survey will be one element and one piece of the jigsaw. So I'll just hand over to Jude now, who's an important member, a key member of our PPI committee to close the session. Thank you very much, Jude, and thanks to everybody again.
Just a final word of thanks to the two speakers, Eleanor and James. I personally learned an awful lot, and thank you to SYNERG-IE for organising it all, and to everybody for giving their time in attending, and just very grateful for all the work that's been done that makes living with Sjögren's a more manageable experience. Thank you.
Thank you, everybody.
Thank you. It's a pleasure to take part.
Thank you.
Thank you all.
Anna's a question there. Will we stay on and answer it, or would you prefer to email it, or what?
If you didn't mind, Eleanor, I think would be great. We're here, so I think if you're happy to speak about it, because it's something definitely, Alan. Thank you for that suggestion. I think we need to think about as part of the broader project going forward. So appreciate the prompt.
Fantastic. It's a really important question, and it's multifactorial in that autoimmune diseases, like there's a lot of diets that recommend things you should avoid, and also similarly in relation to arthritis and things. But again, speaking as somebody who has an A4 page of autoimmune diseases, if you avoid all the food that you're meant to avoid for each of the conditions, you'll end up eating probably nothing. So you have to balance, I think taking a sensible approach and not overloading on any specific thing. I know in relation to arthritis, for example, tomatoes are meant to be very inflammatory, but you have to eat things that you like. So in relation to the oral cavity, it's hugely important, because if you have a dry mouth, you have to lubricate the food, you have to use stews, you have to use sauces, you have to make sure that the food is not excessively dry. It's nothing but an exercise in utter frustration and pain and discomfort if you try to eat the wrong food. You will not be able to manage it, and you will become frustrated, upset, and malnourished. So accepting the parts of the actual condition that you can't change and working with them. So instead of having a dry cracker, or even a dry biscuit cake, if you're going to have dessert, opting for something like a sherry trifle, or opting for something that which has custard in it, opting for stuff that's more moist. In relation to nutrients, it's really, really important, because if you're lacking in iron, if you're lacking vitamin C, if you're lacking in any of the B vitamins, it makes the oral mucosa very, very thin and atrophic. So again, making sure that you have a good nutritional basis is essential. And if you have other issues, for example, celiac disease, Crohn's disease, etc., again, it can be hard to balance the needs of the different diets to suit all aspects of us as complex human beings. So in relation to stimulating your salivary flow, an awful lot of GPs used to say, off you go and get a bag of sweets and suck them. Secondly, if you're going to be sucking sugar all day, it makes your mouth moist for a couple of minutes, and then it makes it usually 10 times drier, roughly 5 to 7 minutes later. Secondly, it's going to stimulate a huge increase in the amount of fungal infections that you get, because sugar feeds candida infection. Thirdly, it also feeds the bacteria that actually eat into your teeth, cause cavities, especially strep mutans. So it is a fine balancing act, and it's a case of, comes back to you being educated, you knowing what suits you, your gut, but also you having a sensible little and often approach, I think, is really, really good. Nutrition is important, really important to be hydrated, using decaffeinated food. Again, caffeine stimulates our stress levels, it stimulates our gut into over motility, and it also dehydrates the mouth. So looking at your intake of food, making sure that you stay extremely well nourished, but also if you're eating little and often, which is great if you have IBS and you have gut disease, little and often means that you're continuously spiking your oral pH into the acid range, which again is going to soften your enamel. So it's, I don't know if I'm helping or making matters worse, because it is very complicated. So if you eat little and often, you have to brush every time you eat, and you have to strengthen your teeth in response to that. And I would strongly recommend looking into the use of GC. It's a special paste which I had on the slide, tooth mousse, because it's easy to use. It's a natural product, utterly non-toxic, but it gives back calcium phosphate and fluoride into the enamel of the teeth to protect them. So it's something really important to look at. It is a complex issue, and I hope I haven't added even more layers of complexity there. And it's fallen off for
Thanks
sure.
very much. Thank you. Thanks.
Yeah, I think nutrition really is kind of, any messages really should be kind of about whole body nutrition. And people often look for a blame factor, like, for example, there would be geographical variance in, say, just purely as an example, in iodine levels naturally in soil in different parts of Ireland. And then there's associations that might lead to thyroid, or, differences or difference in thyroid conditions in different parts of the country as a result. But that's a very simplistic generalization, picking on one factor and trying to link it with an outcome. And then you might have things like, in the context of vitamins, people who smoke generally tend to burn up the vitamin C stores, and people with chronic conditions like arthritis also tend to burn up their chronic vitamin C stores. And as one ages, you don't absorb nutrients as well in many cases. So there's lots of variables that kind of make this a very complex interweave to actually study. So it's a very valid and it's a very valid area to look at, but it's a very complex one. And you can often need to follow it over a long period of time. And how do you measure? What are you looking at? Are you looking at the marker of one thing in the blood? Or are you looking at a more holistic outcome that is more representative of the human condition? It's a very interesting area, but it is very complex. But I think we'd need nutritionist experts on board as part of a panel if one was considering embracing nutrition as part of an overall focus. But we are all we all eat, so it's a very important aspect of any condition, and I think it's a very valid point.
Thanks.
Great, thank you so much, James and Eleanor, for answering those additional questions, and for the people who asked them as well. It's great, great topic actually. I'm sure we could probably do a webinar on that as well. Maybe one to note that there's more to be discussed there. So, with that, I think we'll say goodbye to everybody. Good afternoon. I hope the sun is shining wherever you are, and if not, I hope it's on the way soon. So take care, everyone.
Thank you.
you.
So